This is Selma Schimmel in Chicago at ASCO, and we are now going to present An Advocate in Action as part of our Advocacy in Action series. And I'm so happy to be joined now by Susan Hosbach, the Executive Director of the Minnie Pearl Cancer Foundation.
Thanks,
Welcome.
Selma. Thank you.
I'm glad you're here because, your organization really has a unique history. And tell us a little bit about how it all started.
Well, it is unique. Minnie Pearl, many people don't know any longer, but she was a comedian, that probably one of the first women comedians that was involved in the Grand Ole Opry and Hee Haw. When she was diagnosed with cancer and then successfully beat that, the founder of the HCA hospital system was a good friend of hers, Dr. Thomas Frist Sr., and he had asked if she could use her real name on the cancer center, and she said, absolutely, but I want my stage name, Minnie Pearl, to be given to an organization that provides hope and compassion for cancer patients. And so we became the Minnie Pearl Cancer Foundation in 1992.
What's the mission?
Our mission is to create a confident cancer journey for adults anytime, anywhere.
Your mission uses a unique word. Your mission is to create a more confident cancer journey for adults anytime, anywhere. Mm-hmm. I like the word confident. Let's talk about what that means.
Well, it really means when you first hear that word, everything just shuts down. And you're really not sure where to turn and what kind of information is really going to be the most valuable. What we're trying to do is to provide vetted, expert advice kind of information that allows you to say, now I've got the information that I need, that provides me that empowerment, that when I go through this journey, I feel more confident.
Are you open to all cancer types?
We are. We serve any adult with any cancer, and it doesn't matter whether it's the patient, the caregiver, a family friend, a coworker. We're there to provide the support and the information needed.
How do people learn about you? Obviously in Tennessee, you're in the backyard, but
right.
How do you navigate your way across the rest of the nation?
Well, there's really three ways that patients get to us. One, of course, is through clinic referral. And so a number of doctors throughout the country actually refer their patients to us. Part of that is because of the relationship we have with the Sarah Cannon Cancer Centers and the Sarah Cannon Research Institute, which has...
And Sarah Cannon is
Minnie Pearl's real name. Yes, thank you. And so their relationship, there's about 450 physicians through their relationship, and so we get referrals from all those clinics. The second way, of course, is through the internet. Once you have a website, and ours is a robust one with a lot of information there, then people learn about us in that capacity. And then the third way really is word of mouth, where we've helped someone else and now they have a family friend or a family member who's been diagnosed.
One of the important areas that you're involved in is clinical trial awareness and education.
Yes.
If someone contacts the organization, are you able to help them find a trial? Do you direct them to the resource to help them? How does that work?
Well, actually, in the new system that we're bringing on in a few months, it's a new portal for patients and caregivers. It actually has a search capacity so that they can search clinicaltrials.gov themselves without all the ancillary information that's on clinicaltrials.gov. It boils it down really into 5 key areas. One, you need to know what the trial number is. So that's still on our website. You also need to know the purpose of the trial and a description of the trial, key eligibility, and where I can go. And that's it. That's all that's needed from clinicaltrials.gov. So people are going to be able to search that portal and get that very specific information, or they can call us and we'll do that for them.
You also do something that's real important that's overlooked by a lot of organizations and even, I hate to say it, by healthcare professionals, and that's the area of nutrition.
Yes. It's a huge, huge component of what we do. And probably where we get a lot of our referrals, because most of the community practices do not have nutritionists on staff. Cancer tends to be an outpatient disease, and so there are no nutritionists in those clinics. It is vital.
Your website is minniepearl.org, Minnie with an IE.
Yes.
Pearl.org. minniepearlcancerfoundation.org.
Right.
Any last thoughts you want to share?
We're there for everyone. Doesn't matter what the diagnosis of cancer is or what role you play in that. And please call us. We're there to help.
Thank you so
Thank you
much.
so much.
Susan Hosbach, Executive Director of the Minnie Pearl Cancer Foundation, an advocate in action.
Thanks, Thelma.